be his session. I will be taking the session mostly. We'll
Okay,
take on early clinical exposure and styles of learning. Both we will finish. Have you all discussed the community, that task given to your groups?
Yes, ma'am.
Yes, ma'am.
Yeah. See, my whole idea is why include this. There are many colleges which are completely community based across the world, not in India. Their education itself is, you take the cases from community and from there you learn. See, link it with a learning through the community needs, etc. Of course, they have got the integration of teaching, learning, other things. But here in our DCI curriculum, it is the community dentistry department, and few colleges also now are asking other interns to go and other final year students to go. But my whole idea is there is something called social commitment. Social commitment is, we live in a society, we have got some duty towards the society. So in that, how can I be, oh, okay, I want to do implants, I want to do cosmetic dentistry, I want to do more, earn more money, but can I contribute 5%, 2%, 10% of my time, invest in community health? Can I think of some project in my own clinic wherein once or twice a year I can have a day, like they are having prosthodontic day, something like that you can create for your clinic. It will be a good advertisement for your clinic. And also in the colleges, adapting old age homes, adopting them, going and treating the patients there, or even creating awareness for early cancer in the detection in the elderly patients. Elderly oral health comes along with a little bit of counseling. So all these things, can you do something? Please think about that. And today's session, that's why you will enjoy. There are 26 participants and it's still, I think, 10 minutes or 5 minutes more, 7 minutes more.
Can we start ahead of
time? Yeah, 5
minutes.
5 minutes. I'll give you 2 more minutes for people to join. Then you can.
Okay.
Yeah. So everybody knows Vibha Shetty and Sai Deshpande, Deshmukh. So yes, you all know them, no need for introduction. They're going to do small group with you. They made you really enjoy the session earlier with the large group. You really were active, and the confusion technique somebody asked and I answered something. It really set up a good this thing. Please try the confusion technique. You can give chits to people, ask them to just write their question, but without the name. That is why the answer garden is important. Answer garden does not tell you who asked the question. Chat box tells you. So I may not ask the question very freely. And this can be practiced online also. Isn't it? There are so many softwares which give you slips. Hai na, Sai? Peer deck and all give you, na? And even the Google slides help you.
Yes, ma'am.
Yeah. Okay. So Vibha, you can start.
All right, ma'am.
We want to see you.
Yes.
Yeah. Yes. Pink beauty.
Good evening, one and all. And thank you so much for joining in for this session on student engagement with small group teaching. Dr. Sai Deshmukh, and I've had a lot of fun putting it together. Let me share my screen. Is everyone able to see my screen?
Yes, ma'am.
Yes, ma'am.
That's wonderful. So we are talking about student engagement in small group teaching, with small group teaching. Now, I think especially as prosthodontic teachers, we have had challenges where we have part of the class that has understood what we want to say, part of the class that is clearly not understood what we want to say, and part of the class that is disengaged. We really don't know whether they've understood or they haven't understood, whether they are interested or not interested. And in a large group, one of the disadvantages is that you cannot identify as a teacher which of your students in particular need help. And therefore, small group teaching is a method that has been increasingly adopted by a lot of schools, especially in medical health education. And we have used it extensively with prosthodontic teaching. What are the advantages? One, we'll come to the advantages. In the meantime, I would like to acknowledge all my teachers and my peers who encouraged me to go into exploring teaching methodology, because 25 years ago, we felt that we were, not 25, I would say the first 3-4 years went in doing things that we had done previously. But then somewhere along the way, you realize that you would like prosthodontics to be taught differently. And the reason you wanted to be taught differently is you felt as a student, there were some things that you didn't quite get. And as a teacher, you suddenly realize that not only do you get it, but maybe if it had been told to you in a different manner, you would have understood it better. Not all of us are articulate and forthcoming with our doubts. And therefore, I think some of us looked at ways of teaching better. And to all my teachers and peers who encouraged me to look at health professions education, who encouraged me to ensure quality in the way we teach, and told me that teaching is not about helping the bright students get better. They will do well in spite of me. But the real challenge of teaching is to make sure that the lowest 20% of the class get interested in your subject and want to do better. That is truly your challenge as a teacher. And if you can motivate that 20%, then your objective as a teacher is fulfilled. So to all those people who helped me look in that direction, my sincere gratitude. Of small group teaching, how will we get our students to become learners? How do we design theory and clinical small group sessions and learn to be effective facilitators? Today, I have spent the entire day in an interview for faculty members in our university. And I think I'm going to take this opportunity to thank Dr. Nagda ma'am, who I can't even begin to explain to you her commitment on this project or to this project. Sai will vouch for it in that she has literally hounded us by mail, by message, by phone, by any which way barring smoke signals, to make sure that we attended every planning session. And she started planning for this at least 6 to 8 months in advance of the commencement of the project. And the reason why I'm bow in gratitude and salute her commitment is today at this interview, one of the common threads that we felt, the interview was not for prosthodontists, it was across specialties, but for external candidates. And one of the common threads that we felt as members of the panel is that teaching learning methodology concepts are teachers, and they are still doing PPT presentation. They are still doing things that we did 30 years ago with a little bit of digital enhancement. And while they want to do better, they do not know how to do it better. And truly it is big, you guys have been proactive in enrolling for this program and are truly fortunate to have Nagda ma'am as a driving force and giving you this opportunity where you now have access to this exciting new world of medical health education. So today we're going to be speaking about small group teaching and what are the advantages of small group teaching. It enhances deep learning due to active involvement. Now, all of you who have been learners will know that your maximum learning happens in that breakout room. How many of you disagree with me? Maunam sammadi lakshanam. I'm assuming that
we agree, ma'am.
Yeah,
you
I agree, ma'am.
Exactly. So the key is that we all learn when we are actively involved, even from the time of kindergarten. It is one thing for the teacher to show us what an A for apple meant. But when they gave us that red piece of clay and said, make a little apple out of it, at that point, we never forgot what A for apple meant. To date, I remember my oral pathology teacher who literally used to act out the shapes of the various anatomies of the various dental components. So I remember he would say the dentinal tubules, he would show the undulating manner. And to date, when I speak of sensitivity to a patient, I still remember the way he told us that the dentinal tubules is undulated. So there is, when you're actively involved, that's when deep learning happens. And that's what increases student interest and therefore retention of both knowledge and skills. Most importantly, there is a transfer of concepts to application. We may learn selective pressure technique, but it is only when we teach children that spacer and the tray, we tell them you make vents, you tell them where is the release of pressure happening, what is the role that the vents or the borders are playing in selective pressure. That is when it transfers from a concept of selective pressure to an application of selective pressure. And we as teachers would like each of our students to be lifelong learners. They should be led, or they, as most of us, 100% of us in this group are clinicians. And as clinicians, we never cease to learn. There are always new materials, new techniques, new ways of patient handling, new electronic gizmos, there is so much to learn every day. But only if we are keeping only if we keep our minds open, that's when we are open to learning. And that is something that the small group teaching inculcates in that student from college, that you should keep your mind open and remember to ask questions. It is only when you ask questions, when you discuss these concepts, that it stimulates a higher order thinking, and the student himself or herself takes responsibility for the learning process. And finally, it improves student-faculty and peer interaction and allows for an unhindered atmosphere for clearing doubts. Again, one of the common, I know today we have a bunch of very motivated, very confident young teachers who have no hesitation in asking us questions, but that is the whole point. Not all students are like that. And therefore, most of us in a large group tend to hesitate about asking questions. We don't want to be seen as foolish. We don't want to make our ignorance known in front of other people. And most importantly, we wonder whether our question is intelligent enough. Whereas when you are in a small group, you have no such inhibitions. You can ask the most silly of questions, and there will be someone who will say, yeah, I also had the same doubt. And then you don't feel like you're alone in that group. So that is one of the biggest advantages of small group teaching. Coming to the disadvantages, there is nothing that is perfect. So there is a disadvantage, and it's important that we be aware of it. So what are the disadvantages? One is, if there's somebody like me in the group who talks a lot, then that person will do all the talking, which means that the other people will not get a chance to get a word in edgeways. So you will have somebody who is dominating the discussion, and therefore the others who are just sitting in the background. Now, if you allow somebody to sit in the background, you must understand that their mind will wander, and they will not want to participate. They're losing their focus and concentration. So therefore, it's important that everybody participates. The other problem is that the student may not want to think. It's too hard. It's just in the afternoon. I'm very sleepy. I don't feel like participating in this class, pre-learning material. And therefore, I do not. Give me 1 second, please. I'm so sorry. So under various conditions, the students may not be inclined to participate, or may not even want to think too much. Under such circumstances, they'll keep on looking at the teacher, hoping that the teacher will answer all the questions. You know, sometimes what happens is if 5 people are quietly looking at us, we also get impatient and we tend to answer the question. So that is a disadvantage in the small group, is that you have to learn to stay quiet. You have to learn to encourage your students to talk. You have to learn to question and to nudge them to start a discussion. But your framing of questions is very important. The reason why your framing of question is important is because you don't want the student to treat it like a viva. The student should not be encouraged to just recall facts. What are the factors affecting retention? Then they are just going to start with, oh, physical factors, mechanical factors, etc., etc. But that is not what we want. We want a discussion on physical factors. We want a discussion on how anatomical factors may be more, which is more important, anatomical or mechanical or physical. Then why is it important? So you will want to get them to discuss. I'm so sorry. I'm wondering why.
But there is
Are you able to hear me?
We are able to hear you, but there is a net problem in between it goes.
Really, ma'am? Okay. Yeah, I saw that. I thought my power had gone, but apparently that's still there. So, so most importantly, we must remember that we don't want the student to focus on recall, focus on application. We want them to focus on whys and the hows. We don't want them to focus on the what. And of course, you know, you really don't want the teacher to talk excessively. So what are some of the key characteristics of a small group teaching? First and foremost is the learning that takes place. Then you have the interaction. Why am I focusing on these 5 key characteristics? Because if you look at the learning outcomes that you have formulated as part of your course or your program or your module or even the topic for the day. The outcomes almost invariably focused on learning something. But if you go back to your course outcomes, you also focused on, especially as clinicians teaching prosthodontics, we want our students to be able to be team players. We want them to be able to have excellent communication facilities with their patients. We want them to be able to communicate effectively with the laboratories. We want them to be able to communicate with the peers. We want them to be good scientific presenters. So there are so many things that we are training our students for. I always tell my juniors, you must remember that we are not just teachers. We are not just training students to be good prosthodontists. We are creating leaders of society. Let us never underestimate the role that we play. And because our students are usually 19 years plus, they are at an age where their entire thought process is in the process of crystallizing. And therefore, when you not only impart to them prosthodontics, but you also teach them etiquette, you teach them professionalism, you teach them ethics, you teach them behavior. All that comes by virtue of your own, you are the role model that they're following. And therefore, small group teaching, so therefore, as part of your learning outcome, you will want them to learn interaction. And that is something that small group teaching is able to provide. Your student is not just learning the subject, your student is also learning how to interact with his or her peers. They're learning how to develop a working relationship. They're learning how to develop solutions to clinical problems. They are learning how to take leadership roles. They are learning how to be professionals, and they are also learning how to be confident, contributing members of a team. And that truly, did you lose me, ma'am?
No, I told you, in turn, we also come to know each student personally, their characteristics, their learning style, etc.
Absolutely, absolutely. Because now you are able to know which student needs assistance. You're able to know which, even for peer learning, you are able to identify students who you can pair with each other. You are able to identify students who have a particular strength, and you can capitalize on that strength to help somebody who does not have it. So there is so much that we learn while our students as well learn. So what do we do? What are the key roles of a facilitator? One is we can either give pre-knowledge through handouts, or we can nowadays send pre-learning material, or we can augment a previous lecture with a smaller introduction. Small group teaching, most of the learning must happen from the student side and not really the teacher's side. You need to be organized. You need to plan it in advance. So that is very, very important. You need to plan it in advance. You need to give the ground rules to your groups. They have to be on time. Whether you want them to keep their cell phones, you don't want that. You want them to use PPT. You want, what kind of professional etiquette do you want to follow the rules of the group? You want them to choose a leader. You want them to choose a timekeeper. You want to choose them to choose a scribe. So all those things, you must be specific in advance. And of course, you will need to have some extra colleagues, simply because sometimes if you have a large group, let's say, a group of 60 that you're dividing into, let's say, groups of 8, then you're going to have 5 groups. It's impossible for you to handle all 5 groups. So you will need help. So you will need to get some of your colleagues to come in and help you. So what are some of the key issues? One is to determine the learning outcome of that small group. What is it that we want to achieve in today's discussion? How are we going to achieve that discussion? Is the what aligned to the how? Is our learning outcome, let's say our learning outcome for the day is to understand centric relation, or understand how to measure centric relation. Now, when you have that as the outcome, how to measure centric relation, your learning activity should be focused on understanding centric relation and the various methods, and maybe a role play on how to implement those various methods. Because that way, the student will be able to think that way, when they are actually manipulating somebody's mandible, they will understand what resistance means, what it means, how to get the patient to relax and get that mandible into centric. So determining assessment. How will we know whether the student has understood centric relation or not? Or how do we know that, how can we help the student understand whether their method was correct or not? Have they really reached centric relation position? So that's when we will talk of repeatability, etc. Ensure adequate seating arrangements, because we want to make sure that everybody participates. We want to make sure that everybody has a chance to contribute, and then we will give constructive feedback. Again, when we give feedback, we must remember that we don't want to really get anybody to be, to feel hurt. So we don't want them to not want to participate anymore. So we should be fair in our assessment. We should see how they have participated in today's activity. Always compliment first. Never ever hold anything against anybody, even if they didn't participate last time, but they have participated this time. Acknowledge that participation, acknowledge that they have this time opened up and you so appreciate their contributions. Make sure that somebody's been quiet and they've contributed, appreciated. Somebody's been dominant, then you suggest, while you appreciate their contribution, suggest that they should also allow somebody else to contribute and maybe listen sometimes. And by and large, don't be sharp when giving your feedback. What are the additional requirements from the facilitator for small group teaching? 1 is preparation, key thing. 2 is, why are you doing that small group teaching? How are you going to do the small group teaching? How are you going to keep discussion up? What are the kind of questions you're going to raise? How are you going to make sure that question is moving to another person? How are you going to initiate a discussion? How are you going to elicit a response from all the team members? All those things are additional requirements that a facilitator must prepare for. So what are the types of small group discussions? There are many, many types of small group discussions. It's not necessary that we follow all of them. It is not even necessary that you try more than one, or in your whole course, you can try maybe 3 or 4. Because out of those 3 or 4, maybe 1 or 2 will work very well, 1 or 2 may not work well. It doesn't matter. It's a learning process for you, because different kinds of topics may need different types of methods. Different types of groups may require different types of methods. And who knows the group better than you, because you've been their teacher. So therefore, you can decide based on your group what method will work. So let us say if we are considering brainstorming. Now, what is brainstorming? Can anybody tell me what brainstorming is?
Debate, discussion.
Same of, on one topic, all will give the ideas of their view, ma'am.
Okay. So what
A
could
heated
be
discussion on all aspects of that topic.
all right?
Oh,
So
she said heated discussion. Very true.
Lot of innovative discussion.
Then only it becomes brainstorming, ma'am.
Okay, so let us say, as a teacher, if you're using brainstorming as a method, how would you control the discussion?
Set the boundaries first.
Okay,
Right.
Create a concept cloud.
I missed you. Create a concept
Like
of
one has to express his views only in 1 minute.
Concept cloud.
A time.
Taking time to
excellent. So set a time frame. Set a time frame. Say you will give 30
Limited
seconds to
time.
each person, not more than that.
Limited time.
Guiding towards right direction, like sometimes it may. Yeah, hello.
Okay, so it's possible that you will have multiple ideas coming forth. So during brainstorming, it is important that you brainstorm on a very small aspect. Okay, so today we are talking of small group teaching, but we decide about small group teaching, then there will be too many things coming in this group. So we are asking you only about brainstorming. What are the advantages? What are the disadvantages? Some of the advantages is that you could get a varied set of thoughts. You will get a lot of innovation coming from your students. The disadvantages, sometimes there can be a disconnect. So it is important that the facilitator kind of help them join the dots and put it all together. The other method is a buzz group. A buzz group is a small break that you give during a lesson in which these small groups will discuss a issue, and then they will come back to the main group and each person from the group will talk about it such that the entire class can come to a collective conclusion. Case study, I think all of us are fairly familiar with. We will give students can identify what are the salient factors there and how they can possibly arrive at a clinical solution. It may not necessarily be a clinical problem. Can any of you give me a case study? Can we ask one example of a case study that is clinical and one example of a non-clinical, not purely, peripheral, paraclinical case study?
Can you
Ma'am,
repeat?
full mouth rehabilitation case.
Ma'am,
Okay, but
we
again,
can discuss the TMD patients, like while
Mhm.
the patient came to the clinic of this age, and while opening the mouth, we can hear the click, but while closing, there is no click. So kindly elaborate what type of TMD problem is this and how it can be corrected. This can be a case study.
Fantastic.
Or, ma'am, we can give one case like, a patient is having sort of complaint, say working mouth syndrome. So what will be your differential diagnosis? Something of that, say, yeah.
Excellent. So let us say patient is, the things I loved about your case study is that it engaged a very small aspect of diagnosis. So when you're discussing a case study, it's important that you give just about 2-3 aspects. So but if you give something like full mouth rehabilitation, there is just too much to discuss. You cannot possibly use that as a case study. Now, this non-clinical case study, what I was talking about is, let's say, I have a patient who is a bus conductor and is looking for replacements of his single missing anterior tooth. What would be my possible treatment options? So now the very fact that I slipped the bus conductor in means that economics is a big consideration. So we are trying to see if we can develop empathy in our students, in their clinical decision-making skills. Can we incorporate empathy? Yes, yes, Dr. Sonali.
Ma'am, what example you gave, ma'am, I have done this kind of a small group discussion with my students who are now interns. A similar thing, ma'am, I did where, I mean, I've tried it with gingival retraction. Like two material I have kept and asked which one is better. Then impressions, surveys, like that I have done, ma'am. Small discussions I've done.
Very good. Very good. So then we will look forward to some inputs from you. That's excellent.
Thank you.
Okay. Then controlled discussions. So a discussion where some students may raise questions or comment, but the tutor kind of, I would say, controls the general direction. Maybe what we're doing just now could come under the classification of a controlled discussion. Then you have a fishbowl. A fishbowl is a very interesting concept where you have a smaller group within a group. So the smaller group will discuss a small topic. Let's say in a group of 8, you have 3 who will discuss a topic and the other 5 are only listening to the topic. Then you will have either they will reverse and continue with another topic, or there will be a plenary discussion where the same topic is now discussed by all such that there is a definitive conclusion. Then you have a free group discussion. Now, this is one of the dangerous thing to undertake. I personally find, because here the group discussion is controlled largely by the members and not the tutor. So if you can possibly permit this only if you are totally short-staffed and you don't have any colleagues for the day, and you have identified some leaders in that group who you are sure will be able to control the discussion. Otherwise, sometimes the discussion can go out of hand amongst peers, and it could be not very good use of your time. Then you have a problem-centered group, a group which has a definitive task that is discussed, and then either it is summarized on a poster or it is, the findings are reported at the plenary session. So I remember my first experience with the health professions education. I attended a conference at PSG Coimbatore, and it was the first time I had seen a poster presentation of that nature, and I was so impressed. It was that conference that got us coming back and saying we have to start something like this. But they had a beautiful system where the poster presentations were classified based on the topic. So therefore, everybody from a particular topic were presenting their posters to a very small audience, and then a member of that audience presented a summary of that, whatever happened in that room at the main plenary. So therefore, almost the entire group of delegates got to hear what each of the posters were about without necessarily having that presenter staying there for that poster presentation for the entire length of the conference. So that was very nice. It was just for an hour, but as a fellow poster presenter also, I got to know what my colleagues had presented, what somebody else from some other college was doing. All of it I heard at the plenary. Then you have projects. This is particularly useful for us because we are looking at a lot of practical exercises that we give to our students, a lot of preclinical exercises. So a project can be a small group exercise or a scholarly activity that involves a problem. For example, let us say we want to teach the factors that can impact the setting time of gypsum. So what you can do is you can divide your group, your entire class into several groups and tell them, give each one a project. Give each one, let's say, one you give a little bit of salt, the other one you say change your water powder ratio, the other so various, so on and so forth. And then you have them, so you measure the hardness if you have equipment for it, or you measure the time of setting that it took. So you have them come back and say what they did, what were the problems they encountered, what were the conclusions, and what would be the ideal situation. So this is something that we use very frequently in our practical teaching for dental materials, and we find it very useful in that students then don't struggle to remember water powder ratio, they don't struggle to remember setting time, otherwise they're so busy learning all this by heart. Whereas when we give them a project, and we usually make sure that the project has all the wrong things. We never give them an ideal water powder ratio and say, figure this out, because that they will do anyway. We give them something that's wrong and say, do it here, and say what went wrong because you added too much salt. How did the setting time? Did you have enough time to actually make that cube? So then they understand what is working time, what is setting time. In my experience, I have found it very useful to give projects to students. Then you have pyramid. Pyramid is also called a snowball. And just a small piece of snow will, we have two people discussing a problem, and then two more people will join them. They will now discuss with each other. So 4 people have the same thought process, or maybe different thought processes. It goes on to larger groups until at the plenary there is some form of conclusion. Then you have questions, where in that group, the tutor will display the questions. It gives the student some time to think and then get some answers from them, which you can discuss and elaborate. You can also do it as a quiz. Role play, again, very, very useful for us, especially in prosthodontics, especially for clinical teaching, especially when we have to teach students case history eliciting. When you want your patient to talk, what is the way to talk? What is the way to establish a rapport with your patient? How friendly is friendly? Or how do you make your patient feel comfortable? There is no high role play. It's one of Murphy's laws. Your laptop will work perfectly at all other times, except when you need it to work without trouble. I'm wondering why my PPT is stuck.
You can stop sharing and share again if you want.
Is that right? Okay.
So you have the presentation. Sahi,
Yes, I have it now.
you project it and she can talk.
No, I was able to get it on for a moment, Sai. Otherwise, I will take your help.
Okay.
So the next method is a seminar, which we are again fairly familiar with, where there's a group discussion of a paper presented by a student. There's questions at the end of it. As much as possible, encourage your students to ask the questions and don't make it seem like a viva. I think, which is unfortunately most of the time our seminars end up being more a viva than a discussion. Then you have simulations or using the use of games where participants can enact specific roles, and then you have a real life situation where they get a general idea. For example, let us say a patient, a role play of a patient with TMD issues. So then there is a patient who has TMD, a patient who's a doctor who's treating it. What is the method for muscle examination, etc.? Like Suhasini ma'am, if you look at her, she's doing role play of yelling at a student just now. हाथ दिखा रहे थे मैम अब किसी को. So,
no, somebody doesn't want to do Vibha.
step-by-step discussions. So sequence of issues and questions. So you can draw out the required answers from students. Then you have a syndicate where you have several smaller groups that are working on a same problem within a set time. And then there is a larger group that they report to. The syndicate sounds like the mafia, but it is a fairly useful methodology. Then we have tutorials, which we are familiar with. Again, a meeting with a small group. It's like a small lecture. Sometimes if we have to teach a very small set of students, then tutorial is the method that we choose to follow. And of course, a workshop where students are actually doing something. In fact, this morning at the interview, one of the participants had spent considerable number of years teaching periodontics in Saudi Arabia, in academia in Saudi Arabia. And I'm told there it is a 6-year or 7-year program. And in year 4, the students are expected to learn all kinds of perio procedures on a goat head. Every student has a goat head. And so I was thinking, how useful is that for them to learn how to give blocks, how to do incisions, how to do suturing, how to do, so much is possible when you have a situation like that. Okay. I think I will have to borrow your problem where I'm unable to move my slide.
Okay, ma'am. Should I share?
Yes, please. Can you share?
Yeah, ma'am. Just
Hello, Gaurang, how are you?
Better now, ma'am. Yeah, good. Thank you.
Take care. Take care.
We're able to find it, Sai? Okay, I'll tell you what I'm sharing for now. Meanwhile, you search for the.
okay, ma'am. Okay.
Search for it and then keep it ready. Okay. So I won't go into presentation mode because I think as soon as I share, I'm unable to move my slide. So Sai, just keep the presentation ready. So we'll. What are the group sizes? What are the group sizes? You have very small groups of real or a buzz group. Then you have small groups of 6 to 15 people, which
Have
is
a slide view. Slide view.
Ma'am, if I put it in slide view.
Ma'am, I have opened it. Should I share? I have opened it.
Okay, no, 1 second. For the next slide, you keep it ready. Okay.
Okay.
So then you have small groups of, let's say, 6 to 15 people, which is useful if you're doing your brainstorming or your group size gets bigger up to 29 people if you're doing a seminaristic approach or a problem solving activity, and a large group of 30 to 49 if you're doing syndicates where you have smaller group sessions that will report to a plenary, and then you have very large groups of 50 or more. Usually that becomes difficult for small group, and 50 is usually something that will really come under the large classification of large group. Then you have different seating arrangements. You have this useful for a seminar. This is useful for a tutorial approach. Then you have the smaller brainstorming or the buzz group seating arrangement. Now, let me get some feedback from you. Can any of you volunteer, or two of you volunteer to say which one of these seating arrangements would you prefer for small group teaching and why?
And B.
E, ma'am.
Ma'am, C.
F.
Okay. So we had somebody who said B. Dr. Devi Prasad said B.
Yeah, ma'am.
Okay. So could you tell us why you prefer B?
Ma'am, we'll have face-to-face interaction with all.
Okay.
All the group members can interact with each other.
Okay. So they can actually see each other, correct?
Yes, ma'am.
Okay, that's fair enough. Somebody said C.
Yes, ma'am. See.
Yes, ma'am. Yes, madam. You.
Go ahead, please.
Madam, it is divided into 4 groups, and each group discusses and comes to the instructor with answers.
Okay. Okay. So that is perfect. Okay. So there was somebody who had raised their hand.
Yes, ma'am.
Rekha, Dr. Rekha. Yes.
Yeah, ma'am, the choice will also.
Dr. Rekha, can I change the question?
Yes, ma'am.
Can I change? Which one would you not prefer at all for small group?
Probably
E,
ma'am.
No.
No, then
A,
not at all.
ma'am, that actually what I was thinking, that actually depends on what teaching method I'm planning to incorporate in my lesson.
So it's a small group discussion.
So based on that, I would choose my seating arrangement.
Very good. Very good. That is very true. So let us say you're having a seminar kind of method, then your E is a perfectly suitable arrangement. But if let's say you're doing a buzz group, or let's say you're doing brainstorming, then maybe a F or a C is very useful. Maybe if you're doing a fishbowl, then B is useful. So it's dependent really on what is your plan for the day. So that is why we said, if you remember earlier, that is very important that you plan your method, and because you have to plan your logistics for that method. Not all our classrooms are going to be like this on a routine basis. And therefore you need to have an auditorium like classroom where you can move the furniture, and you have to get somebody to move it accordingly in advance. Encourage active and participatory learning. Send your material 24 hours in advance. Encourage questions, feedback. Encourage self-learning through smaller groups, and set a climate without fear of being yelled at. You know, if I may go back to the previous slide, one of the things that I find problematic, find very good about seating arrangement number F is that the facilitator is truly a facilitator. Your teacher cannot become a deterrent to the discussion in seating arrangement number F. So that is one of the things that you must remember, is that most students feel that if they say something wrong, then they can get yelled at. So one way of encouraging students to participate wholeheartedly is to ensure that there is absolutely no yelling in this class. We are looking, this is a democracy. You're welcome to say whatever you want. We will guide you through it. The whole idea is that at the end of this, when we have left this classroom, your concepts and methodologies on this particular topic should be crystal clear. Okay, so and then we want to generate interest, and we want to encourage participation. So one of the key things that you should do is you should come on time. You should set some ground rules on what time, mobile phones, etc. We spoke about it. Give constructive feedback. Reward positive behavior. Last time Dr. Sucheta ma'am was talking about chocolates. But even if you don't give out chocolates, you can just say a kind word, and that itself is a reward enough for students. Sometimes what I do is I actually give them scores. So right in the beginning, we say these many questions, and if you finished on time, the team that finished first, the leader who was most clear and lucid, the group that asked the most interesting and controversial questions. So we grade them on that. So for everything we grade them. So then at the end of the class, each team is kind of competing with each other, but it builds a very strong sense of teamwork. Now that little group of 6 or 8, they are a unit and they are trying to make sure that they get the best team for the day award. So nothing we give them, no internal grades, nothing. Is just a small competition we create at that point. Then speak privately with disruptive students or ask a question to someone in their vicinity because you want to distract from them. And then maintain eye contact with disruptive students, or you approach them as you talk. This is something we use very often in our large group teaching, don't we? Some student looks distracted, then you pointedly look at them such that they feel embarrassed. Or some student is feeling sleepy, he's going to fall asleep in a moment. You will wake them up with a question and then keep looking at them so they feel guilty enough not to fall asleep. So those are some of the things that all of us have become experts at. What are the benefits of small group teaching? Like I said, there's academic, there's social and psychological for the students. Okay, so at this point, shall we split into our 5 breakout rooms? Before we do that, I'm going to give you your team activities. So team one, you will need to plan 2 learning outcomes and 1 small group method to achieve those outcomes. I'm sorry about the grammatical error. And just 1 small group method to achieve those 2 learning outcomes. That's for team 1. Team 2, use snowballing to arrive at a lesson plan for making primary impressions. Your lesson for the day is to make primary impressions. You have to make a lesson plan, that is your exercise, but you use snowballing to arrive at that lesson plan. Team 3, devise strategies to improve participation of all the team members in a group. Let's say you have a small group of 5 to 8. What strategies will you use to ensure that all your team members are participating? Team 4, you can choose any small group teaching methodology of your choice. You please justify it, but your topic for learning is deep learning of centric relation recording. Okay. And team 5, use the fishbowl technique to inform your peers on the role of questions in small group teaching. How do you question? Why do you question? So use the fishbowl technique to be able to arrive at this. Now, what are the ground rules for your small group learning? 1 is that we would like everybody to participate. You will get exactly 10 minutes. In 10 minutes, we would like the leader to please come back and report on your problem and how you have solved your problem using a small group technique. Do we have any questions? Yes. So let's go in the breakout rooms.
Join your breakout rooms. So हम 10 मिनट પછી બંધ કરજે હા.
Okay, madam.
Sai, will you go into breakout room 4 and 5, please?
Yes, ma'am. Yes, ma'am.
Ponshekar, you joined after a long time, no? Kushali?
Ma'am, his audio is not yet connected, Ponsekar.
I think Ponshekar is practicing or doing something, not attending. Poonam? Poonam? See, Santoshanand, Poonam, Ponshekar and Kushali, these 4 people, you don't even know the breakout room has come. You are practicing or what?
No, ma'am, I'm waiting there. I'm just imagining usually in this group, my name is not there in this group.
Just join the group, that's all.
Okay, okay.
मैडम मैंने उनको उनके ग्रुप के हिसाब से सेंड कर दिया उसने.
अरे खुशहाली को भी ये कर, सेट कर.
Then group 2, okay, okay. Okay.
Gaurang.
हाँ मैडम.
It has become very didactic and also
Much. Group 4.
You all join your group. Just click on the group and join. Gaurang.
हाँ मैडम.
बहुत ज़्यादा didactic हुआ, I don't know, and this could have been finished in 45 minutes and.
नहीं अभी यही इसलिए that's why the faculty also need to be, it's not just about the knowledge है सबके पास, लेकिन delivery also matters.
So we never realized that, and one thing is that take the presentation from them from before. ये अपन ने इतना दिन किया ही नहीं. तो अभी कैसा करेंगे?
Presentation ये लोग बहुत hesitate करेंगे presentation देने को.
नहीं विभा.
नहीं वो नहीं है अभी.
Co-host हूँ क्या? Okay, ठीक है. Yes, ma'am.
अरे last time you all made it so interactive, so that's why I did not bother. Today also we could have made it more interactive, and those slides where there are foreign pictures, no foreigners, please change them to the groups in your college or something like that. I would appreciate that.
Which foreigners, ma'am?
Those small group ka pictures, one was just animation, that was okay, but other rest of the pictures if you observe,
हाँ ठीक है
वो है. और है ना बहुत डायडैक्टिक हो गया रे आज. तू और साई के बीच में there should have been dialogues. Some you present, some he. It doesn't matter. But see, ultimately then what happens is they don't learn. They are very smart. Some of them are not joining the what group? This breakout room. I said, I called up and said, are you sleeping? Then they joined. Last time they were overactive, if you observe.
Yes, yes.
Yeah, yeah. And now I think with the lesson learned, I want people to send the presentation to Chinmay from before. So he can also project.
Correct.
Yeah, I never realized it. All these days, both had, so it somehow worked out.
I know today my laptop really acted up for some reason.
I don't know whether it's laptop or internet because your voice was also breaking.
Really, ma'am? Oh, okay.
There are 2-3 participants who wrote on the chat box.
Yes, yes, yes.
And one person wanted to know how to assess small group.
Yes, I will
Yes,
take that question. I
ask
saw
them,
the
ask them to answer in the chat box.
Ask whom to answer.
All the participants, how will you plan assessment? Then
Okay.
you answer.
Okay, okay.
बाजू में 2 बेडरूम का फ्लैट सेल है, 815 कारपेट है.
This meeting is being recorded.
How are you, Aarti?
Thank you. Nice to see you. When are you planning to be here in Pune? Shortly?
No, Baba.
No, ma'am. आप booster dose ले लिए होगे ना? You
नहीं,
must have taken the third
नहीं
dose.
लिया है,
नहीं?
नहीं लिया है।
Okay, okay, okay. Now we have come with that. You must have seen that Gurukul. It's an online activity coming up in Feb.
Ma'am, a humble request if you can get 2 more minutes, ma'am. There was less time.
Okay.
Can we get 2 more minutes?
We'll give you 5 more minutes. Samir, is that possible?
Thank you, ma'am.
Thank you, ma'am.
5 more minutes.
They're happy.
This meeting is being recorded.
Why this comes?
Has everyone joined back to the main room?
Joining. Many from our group yet.
So last time I remember they said we must not start from team 1 or team 5. So maybe we will start with team 3 this time.
Good evening, ma'am. Ma'am, our top, I am speaking on behalf of our group 3, ma'am.
Thanks, Dr. Lalit. Go ahead, please.
Ma'am, our title is Devise Strategies to Improve the Participation of all the team members in the group. So we have come up with these points, like we can give some role play, we can give some game-based studies, we can give different seminars, we can divide everyone, and everyone has to speak on some time-bound things like from 30 seconds to 20 seconds. We can give we can give them small projects. We can give some case-based studies. And we can have some brainstorming, like we can ask some questions like what is centric relation, and we can tell all the different methods by, and we can ask everyone to give details about those methods. We can give some assignments also, and we can prompt in between. You have to prompt everyone, like you speak something like that.
All these methods you want to incorporate into one small group session?
Like maybe it will be scenario based study.
Okay.
Yeah.
So,
like
so let us say you have one small group session where you have used 3 or 4 people who are not participating. How would you, as a facilitator, get them to participate?
Okay, ma'am, we can like if 3 people are not participating, we can ask them directly some questions. Like if one person has given some answer, and if there are some other possible answers also, so we can ask them to prompt, and we can ask them to give some answers or give some feedback or something like that. Or we can ask them to write about something.
Yes. So you can create a small buzz group within them.
We did that.
And instead of taking some name and calling out, you can just say, aisa hai, don't you think so? We
Yes,
want
ma'am.
to add? Do you want to add?
Yeah, prompting
And
like
they
something.
are, yeah.
Yeah, prompting.
Ma'am, we can assign some role according to the scenario and then ask them
Or
what
we
would
could
you like
ask
to
them,
do?
can you just
That way?
Role play, ma'am, like you have given example, some is a patient and how you deal with that kind of patient, how you ask them the questions and how you behave in here like that.
Yes. Yes. You could possibly also ask them to identify faults in what the others have said, or methods by which whatever the others have said can be improved.
Yes.
You can ask them to suggest what could be the right or the wrong method amongst
Right
what
or
the
wrong.
others have said. So it's not like they have to come up with bright ideas. They can also, Okay, that's wonderful. Thank you, Team 3. Everybody, please give a round of applause to Team 3. That's wonderful. Can we have Team 4 now?
Yes, ma'am. Good evening. So we are using the role play technique for ensuring deep learning of centric relation recording. We're using this because it's an active learning procedure in a simulated scenario. And out of this, we expect that the students would learn at least how to make the choice of the technique. Then among the clinical skills, they will learn the proper chair, patient, and operator position and the significance of these. For communication skills, they will learn how to elicit the patient's cooperation, demonstrate the procedure to the patient, and explain to the patient how we expect them to cooperate with us. It will by the reaction between the role players, they would learn to empathize that if the student is going to get flustered by the non-cooperation of the patient is just going to get worse. You're not going to get the correct recording.
Right.
And the facilitator can then take it towards what are the challenges that you may expect in recording of the centric relation and how to then deal with that.
Wonderful, wonderful. Can absolutely, absolutely round of applause. Big cheer. Can somebody say what Dr. Neha's team has achieved and all that she said? What are the learning outcomes that they have achieved?
I can say goodbye today.
I thought anybody.
From the same group also, ma'am. I'm from the same group, so
go ahead, please.
Ma'am, what we discussed about
what were your learning outcomes?
Yeah, why we chose this technique, the learning outcome in centric relation recording is application part of the whatever we have taught, the application of the theory. Then second thing is very important is communicative skills. Making the patient relaxed and then get the help out of the patient to record the procedure. So communication skills and application of the skill or the clinical skill.
That's excellent. That's the whole point. Through one small method, you have taught them concept of centric relation. You have taught them to differentiate, to critically analyze the different methods. You have taught them the application, and you have taught them interpersonal skills between that very important relationship between the clinician and the patient. So with one small activity, you have been able to achieve so much. That is phenomenal. Very, very good. Can we go to team number 1?
Yes, ma'am. I'll be presenting on behalf of group 1. We were asked to choose 2 outcomes. Now, the outcomes, as far as outcomes are concerned, we have decided on the clinical scenario. Like the first outcome is know about the different arch forms for the completely edentulous patient. And second outcome is know about the problems associated with the different arch form for the edentulism patient or edentulous patients. The method which we would like to use as far as the small group methods are concerned, the problem-centered group. We would like to use a problem-centered because they're supposed to know the problems which are associated with the different arch forms. So ultimately, it will be an open-ended discussion with their findings regarding the problems associated with the different arch form. And the position for the same, we would like to use the F position for their sitting position I'm talking about. And controlling factor for the same will be, we give them some time limit, say 8 to 10 minutes. So we will have control over their open-ended discussion.
That's excellent. That's excellent. Thank you so much, Dr. Darshana. Your seating arrangement was perfect for the problem-based approach. You had you were very clear about what was your learning outcomes, and you were going to ask them, you were going to give them the problems, or were you going to ask them to create the problems? You were going to give them the problems and discuss it.
Give them the problem and discuss it. Yes, ma'am. Yes. Yeah.
That is wonderful. I think you all have just nailed it. Can we have team 2?
Shali, you're not audible.
Kushali, you are on mute, I think.
Am I audible, ma'am?
Yes, you are now.
I'll be presenting on behalf of Group 2 today. Ma'am, our group activity was the use of snowballing to arrive at the lesson plan for making primary impressions. So it is also known as the pyramid technique, in which a group of 2 will start with the group of 2, and will give the information, like they will ask the question and they'll discuss among themselves and arrive with the definite information. And then they'll again include 2 more members, and it will keep on building like that. And from a small information, it will gather the larger amount of information, and it will grow like a pyramid. That is why it is known as a snowball or the pyramid technique. So we were a group of 6, and we decided to divide in 3 groups. In group 1, there was a Dr. Rupinder and Dr. Diksha. They decided to explain about the definition and objectives of primary impression making. And then 2 more members got involved, Dr. Samas and me, and we discussed about the objective. Then we build up on that about the tray selection and the material selection for impression making. And after that, 2 more members included, and then we arrived discussed about the advantages, disadvantages, and the technique of impression making in a whole. And that is how the larger pool of information was gathered like a pyramid.
That is wonderful. That's wonderful. I think you'll have used the technique perfectly to arrive at your lesson plan. So therefore, you have almost in a matter of just about 7 minutes, because when I came into your breakout room, you were still kind of debating on how to go about it. But in a matter of 7 minutes, you've actually arrived at a full lesson plan on what to do, how to teach primary impressions. That's excellent. So thanks, Dr. Kushali. And can we have team number 5?
Good evening, ma'am. I'll be speaking on behalf of team number 5. Our topic was fishbowl technique and how to inform your peers on the role of questions in small group teaching, learning. Ma'am, the thing is that we were a bit confused, but what we understood was after the discussion was that we took the example of a clinical group that comes for the clinical posting to the department every month. A set of students, say example, there are about 10 students. So in this case, if we are using this technique, what we would do is divide this group into 5 each. And like say example, we are trying to teach them the different definitions that are there for centric relation. Again, we are taking the example of centric relation. So since there are varied definitions, we as the facilitator would put an open-ended question like, what do you all understand after dividing them into 2 groups? What do you understand with centric relation? So, and we would allow one group to discuss that, whereas the second group would be a silent group. And what the role of questions would basically be asking them, can you clarify what have you all found out? Before that, I'm guessing we would have to give them some kind of handouts or some kind of matter so that they may have read it. So then to clarify, to give any evidence of what they have understood. Once one group has given us sufficient amount of information, a discussion has occurred, then the silent group, we would do a role reversal, as in the silent group would then aid in the discussion. And if there has been any kind of, where we've not understood something, they would help in that. And then there would be an overall discussion. So this is what we understood. Basically, the questions have to be open-ended. They should allow a discussion. And in the fishbowl technique, it's basically, it would help, these questions would help to facilitate the discussion only, and to form a team building kind of a sense among them, to have a collaboration among those 5 people, so that where one ends, the other starts, and where the other stops, the other will, so there is a discussion like a chain starter basically. And the other group would just sit down, listen to them, and at the end of it, they would give their inputs through a role reversal technique. Ma'am, this is what we understood.
You understood it perfectly, Dr. Kathleen, wonderful. So essentially the whole idea is that one of the disadvantages in a small group is that there could be multiple people talking together, which means that you don't have anybody listening. The advantage of a fishbowl is that you have a small group who's talking and the rest who are listening, and then you reverse the role, or you have the initial talking people now talking to the quiet group, or reversing it. But at the end of your session, there is a definite conclusion that everybody will more or less agree upon. Okay. Is that has everybody understood what Dr. Kathleen said? I think she used you use the example of centric relation again, Dr. Kathleen?
Yes, ma'am. Yes, ma'am. The definition, and for example, was a definition of centric relation, because there are varied definitions of centric relation.
Mm-hmm. Yes. So like, in case of a debate where there's a debatable topic, so you debate about the various definitions. So there maybe one person will say one, the other person will say the other, third person will say the other, and then they can justify, while the others are only listening to it and arriving at conclusions. Then they turn around, and now the quiet people will say why they should go with any one definition because of ABC points. So that is essentially how the fishbowl will work, because everybody is thinking about why, whether person number 1 was right, or person number 2 was right, or person number 3 was right. They're able to understand the concept, they're able to understand the physiology, they are able to understand why practically this particular definition makes more sense. Okay, so that is wonderful. I think a big round of applause to each one of you. You did such a good job. I could see what pleased me the most was when I came into your breakout rooms, there was such animated discussion happening. And what was very good is in most of the groups, almost everybody was participating. That was excellent. And I was particularly happy with team 3 because their assignment was to improve participation, and all of them were participating. They were very happy, the one fun group they were. So can I share my screen one more time? Yes. So there was a question on chat on how can we determine Dr. Niranjan asked, how can we determine assessment within the small group? So yes, Dr. Meda, I'll come to you in a moment. Can anybody attempt an answer to this?
Maybe we can give points.
Okay.
Somebody can. Yeah.
Ma'am, there are rubrics for participation, yes, for presentation, for the knowledge factor that has been added, like different, like for example, when you have PBL, there are different sets of assessment method. Basically, your on the basis of their participation, some rubrics are made before.
Correct.
So based on that rubrics, you are giving them whether they participated, did they like for example, there is thread. So are they participating on the on blogs different ways like in PBL, or they participated in their peers presentations, they ask questions like that. Depending on which small group teaching method we are using, the assessment tools are made accordingly.
Excellent. Is there anybody else who would like to contribute? Dr. Vaibhav, that was very good. I'll come back to this. Anyone else would like to add their thoughts? So, yes.
Ma'am, basically.
Go ahead, Dr. Devi Prasad.
Ma'am, basically, this is actually learning method. So assessment will be a different category.
That is correct. But we also want to know whether what is the objective of our teaching learning method, that the student must understand something very well. So we really want to assess whether our method has been effective or not, right? We want to make sure that each one of the students in that group has understood the learning outcomes of that class, or whatever has
Then
achieved
we can
the learning outcomes
definitely
of
take
that
feedbacks.
class. Correct. Yes.
So we
So
can
you
take
can-
feedbacks.
Yes. So there are two things here. One is assessment about the about the learning outcomes achieved by each participant, for which we may prepare a rubric in advance where we are assessing quietly in terms of what is each person's participation. Has participant number A to F seem to have understood the learning outcome? We are not assessing them in terms of giving an exam or a viva. One of the reasons why we give little scores, keep a flip chart, is mainly to improve participation and to increase involvement. So that is where the role of the rubric ends. Dr. Devi Prasad raised a very valid point in that this is also a very valuable tool for you as a teacher to understand how effective your teaching methodology has been. So therefore, you can also form a rubric, a very well-formed feedback form with a rubric on the various aspects. What is it that you did not understand in this class? Like we had our muddiest point last time. Or did you have enough time to discuss this? Or were you clear about what you had to do when you entered into this small group discussion? So we have to be form this rubric. So therefore, when you get that feedback, that helps you improve your small group session next time. It also helps you understand whether your assessment, because you may have thought that every student will participate, but maybe you will find differently. So then next time you will want to change your method. So when we speak of assessment, there is a two-way assessment of whether the student has understood the learning outcome, and the assessment of whether your system, your choice of teaching method was correct for this group or not. There's another question that says there is a disruption in snowballing. So there is a further subdivision of the group into subgroups. Yes, there is, but there is a leader who has to take charge and say, this is the amount of time. In this much time, you come back and group together so you can talk to the next subgroup. So yes, there is a disruption, but it will all come back together to form a whole. Just as in the team that did snowballing today, they were able to come out with a lesson plan on how to make primary impressions, and that was within 10 minutes. They knew exactly what they wanted to teach in that class. That is incredible. So therefore, yes, there is a disruption, but it will fall into place.
Ma'am, like in
Dr.
tutorial,
Niranjan says the best.
yes, ma'am. In
Go ahead.
tutorial, you're having the pre-test and the post-test. And
Yes.
basically, in all these methods, the assessment, you are checking for, except for psychomotor, all other domains can be tested, like knowledge, cognitive, and interpersonal. All things can be tested by the small group learning, and it is assessment of what, not only by what the student has learned, but also what are the teaching strategies, whether it is perfect or for this or not, and what about the faculty who's actually performing. So it's basically the assessment of all three: the student, the methodology, and the faculty. I feel that
It is like assessment of learning, assessment for learning, and assessment as learning. As the Harden puts it, all the strategies can be used over here. Now, Bibha, we have only 2-3 minutes more.
Yes, Dr. Rekha will take your one question and we'll close with that.
Ma'am, you just quoted a disadvantage of small group learning, that the students, they focus on recall rather than application. But why is it so, ma'am? Rather, in a small group, we can concentrate more on each and every student. So it will be more application based instead of recalling. Well, why are we taking it as a disadvantage in a small group?
Yes. So what I had told you is that not frame your questions right. So if you say, what are the principles of, what are the principles of retention? then that is only a recall. They will end up speaking about the principles of retention. Whereas if you say, frame your question as, can you compare mechanical means of retention with anatomical means of retention? Then you are talking of application of those principles, right? So that is when your small group will become more interactive. A lot more people will participate.
Okay, so that depends on
Right.
the
So
teacher.
for instance, let us take this small group as an example. Now, when you spoke of snowballing, now the very fact that 2 or 3 of you had so many advantages to speak of small group discussion, which means that you all are now collating all the thought processes put by your multiple parties, and you all have understood the advantages of small group discussion. Bilkul वैसे, you frame your question right. Recall is not the object of the small group discussion. That is the only thing that you must remember. Okay.
Right, ma'am.
So with that, we are going to conclude this session. And what we must remember is that a session that has gone well gives great satisfaction to both the student as well as the teacher. And it's one of the most rewarding experiences, just as this session has been for both Dr. Sai and me today. Thank you so much.
Thank you, ma'am.
Thank you, Vibha.
Thank you, ma'am.
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 Breakout room, really you all enjoyed, I think.
Yes.
So we'll move over to the next session now. Pushpanjali, Vibha, stop sharing.
Yes, ma'am.
Thank you, Vibha. Thank you,
You're
Sai.
most welcome, ma'am.
Yeah. Pushpanjali. I don't know whether she has joined.
She's there, ma'am.
Yeah.
Yeah, she was there. Ma'am was there.
Ma'am is not
Ma'am,
audible.
your audio is
No,
not
no, no,
working, I
no.
think.
She's muted, I think.
Yeah. Dr. Pushpanjali is from, again, Bangalore. She will introduce herself, but I can tell you one thing about Pushpanjali. Very dynamic personality. And she is Famer Philadelphia Fellow, very active in education. And you will enjoy her session. She is a community dentist. So little respite for you from seeing all prosthodontists, and you will like it. So over to Pushpanjali. Pushpanjali, can you please come in? Pushpanjali and Sai.
Yes, ma'am.
Yeah, Pushpanjali is there.
Yes, ma'am, she's there, but somehow her audio is not working. She's trying to speak, I think.
So in the meanwhile, all of you can share how is community medicine or community practice in your dentistry practice in your institutions, and what is the role of your department, you as HOD or lecturer or associate professor or other students who are postgraduates. Can you share, each one of you?
In our institute, ma'am?
Yeah.
In our institute, we are frequently doing the camps, and what we routinely do, because since our institute is far away from the city, so we don't get enough patient from the city. So what we are doing a routine camps in which we have a team, like one staff, one intern, one PG student, and they will go one day prior. They will announce that tomorrow we will be having a camp. So whosoever want to register, they can register. And next day the bus goes there, bring them the patient, and the interns and PGs who are bringing the patient in the respective department, they suppose their cases there, they will work on them so that they will come close to the patient, because they are getting the patient from there and they are working also. So even in that way, we are developing a OPD, which is quite well till now. We are doing it from last 1 year, and we have developed a good OPD from these camps.
So this is a general way of increasing the OPD. But
Yes,
I talked in the beginning about your social commitment. You are aware that people are partially edentulous, most of them.
Ma'am, one more thing I like to add here, the patients who are coming from the villages, we are not charging anything. We are giving free of cost dentures.
Most colleges do not charge or very minimally, because so that the patients, they get the patients. So I am talking a completely different perspective. What I am talking today to you is,
Ma'am, can I intervene?
no, 1 second, let me complete. Why I'm talking to you regarding the role of prosthetic department, active role, engaging role, contributing for even preventive prosthodontics. There are a lot of preventive prosthodontic practice. In your own practice, do you practice any social responsibility? Do you discharge? So are our colleges adopting any old age homes, or they're able to cater to the public, even younger ones, as to tobacco cessation along with the community department, so that, see, many of the cases which come to us, submucous fibrosis, later on when we see when the disease is in secondary and tertiary stage. I am talking of not only primary, I'm talking of preventive. I'm not talking of curative, but preventive. So think of it, can we increase? Pushpanjali, are you ready? Pushpanjali? Okay. So my whole thing is, go through the Dental Council of India syllabus, see the curriculum of your university. The role of community, yeah.
We have a similar program. We call it as a Vatsalya, and in which we have adopted all the old age home which belongs to the district of Ahmedabad. And we not only just do the diagnosis, treatment planning, we actually treat them, and we diagnose, then we conduct the denture camp over there. We go there.
Pushpanjali is here. Pushpanjali,
Yes,
can you start? Can you start? I can't hear you. Okay. I think that's a very good thing, Darshana.
Yes, ma'am.
So I want to know what is happening around the world. So I think Shamas can come in, Devi Prasad, Vaibhav. What are you all doing?
Community, we don't do. Ma'am, I am speaking in between. A very good coincidence that today only I made a 1 minute reel making competition for SPDC Varda on preventive prosthodontics.
Very good. Very nice.
Ma'am, at our place, we have mobile vans. We have 6 mobile vans that are going.
Do the prosthodontist go in that van?
Not regularly, ma'am. Not regularly.
My question is that, are we not socially committed?
We are trying to coordinate with the community department if that thing is possible, because till now the mobile vans are going, they do small treatments there, but not the prosthetic part.
The small treatment means just examination.
Examination and fillings also, ma'am. Fillings or maybe small
Whenever we have this denture camp, that means we are expecting that more and more people are edentulous. We just treat them. The treatment planning is known to everybody. Just treat them, give them the denture. Next camp you hold, again they will come, paila wala nahi pehna. So what are you achieving? Are we not having some target? Okay, see, prosthodontics is just not. Whenever Pushpanjali is ready, let me know, Sai. So, when prosthodontics is just not restoration, just not aesthetics, just not cosmetics, and it's just not implants.
Right, ma'am.
You are looking at the person first, the whole individual. Okay, then you are looking in the mouth, because the mouth is a part of the body.
Yeah.
When small example I'll give you, unless we create a impression on the community and on our medical faculty, fraternity, and other fraternities like nursing, physiotherapy, occupation therapy, and other all, they would not respect, and they don't know what we are doing. That is why we celebrate the prosthodontic day, no? On 22nd of January.
Today we have made a small effort, ma'am. We have taken help of the clinical psychologist to make a video, and patient information, a small presentation on patient information, addressing to the psychological aspect of especially the maxillofacial patients with mucormycosis that have been coming to our department for last few months. So we thought that how to help them in dealing the stress that they are undergoing and the dietary counseling. So we are working for the prosthodontist day. So this is a different aspect, not per se treatment, but the psychological aspect to help them out to cope with that.
So I want all of you to think about your role in for the community in your own institutions. Ramat, you are listening to me. Pass
Ma'am,
this
yes,
message on to your department.
Yes, ma'am. Actually, ma'am, in 2020, we for the prosthodontist day, we had been to the Shivananda Gurukulam, ma'am. They were old age people.
Not only Shivananda and not only 22nd January. You have to make a part of it throughout
Yes.
the year, distribute
Yes, ma'am. Since after that,
it should be embedded in your own routine, in your regular practice in college and also institution and also in the clinic where you are practicing.
Yes, ma'am. Since then, we've been going to that old age home, and we've been providing care. Our PG students and staff, we go in rotations, ma'am, to that old age home.
Yeah. So when the person is having a missing lower and a very young person, there is so many things are interrelated play with that. Not only occlusion, not only his periodontal condition, not only his general well-being, TMJ, etc., or the stromatognathtic system as a whole. If at all we take a timely action on replace, first of all, the preventive dentistry should have seen that the population don't lose the teeth. But now the disease has progressed. How much further to stop? And what is our role? Are we limiting ourselves like this only to a small aspect? You have to think. See, these things can be also discussed in small groups. I want you to now think about why the fishbowl technique is called fishbowl. Why is the snowballing called as snowballing? Is also small amount of snow, it keeps on building and making a big snowman, right? So snowballing, when it rolls, the snow rolls, and supposing it just gels and hardens, more snow comes on that. So how is your discussion built on the previous discussion? Think about that. What do the fish do in a bowl? Why do we call it as? There are 200 small group techniques. I want you to understand, ultimately there are only 10 to 15. They're all subsets of that. And I can innovate right now here something. Every time your class is there, I think of some innovation and create that, okay, Aaj I will do like this, Aaj I will do like this. So generally, with regular these things, we have less didactics and more of, today was little exception, but the end you enjoyed a lot, I think. But you know what? We want you to be learning deep. At the same time, I want you to think about how community practice can be, part of us. How can you help the population to understand? I can increase my practice either with creating awareness as a person who is really socially committed, or I can increase and advertise as an implantologist where I have hundreds of competition. I want you to look at patient as a whole. Patient should really be respectful and patients should really feel that we care for them. Patients don't care how much you know. They definitely care how much you care for them. This is my first statement when I enter right in the first year BDS to the MDS. I repeat this statement and all of them know in the college and they used to note down. Patients do not care how much you know. Your degree may be PhD, double PhD, triple PhD. But patients do care how much you care for them. Okay. So with this background, I hope that Pushpanjali is ready, or you have been given the group task. Shai, we can take up that, or you want to take up later?
Ma'am, Pushpanjali ma'am is joining us. So first we will do with the session.
Then the group task.
Then the group task, yes.
Yeah. So Pushpanjali will also look at the present syllabus, your role. Don't always think of restraining yourself narrowly with Dental Council of India syllabus or university. If you do a little more, nobody is going to hang you. But we all want to minimum requirement करना है अपने को, लेकिन minimum से ज़्यादा जा सकते हैं, और maybe minimum maybe we are not explored enough. So basically we need to explore, we need to think, and see, thought is such that it can stray away. What everybody is doing, taking a van and going, bringing patients, free देता है, तो ये OPD increase होता है, DCA का fulfill होता है, वैसा नहीं. उसमें भी आप, can you think of innovation? Can you be helpful to that patient whom you are taking and bringing to the college? What help can you give? Does he have some other medical problem and you can address that in the adjacent institution? Can you help him with something else? So it is very important to innovate. A teacher's duty is to always keep on innovating, and that is what gives you a complete. So Avinashi, do you have any community dentistry?
Ma'am?
Yes.
Ma'am, good evening, ma'am. Dr. Pushpanjali over here.
Yes. Over to you.
I had a small technical issue. Somehow Sai suggested that I use my phone as well as laptop. So I'm using both.
So can you put your video on?
Yes, it is. It is.
We can see, madam. We can see her.
Yeah.
मैं नहीं देख सकती है, मैं देखती है.
Ha, ma'am. So, good evening, ma'am. Thank you so much for this opportunity. It was wonderful.
मैं देख सकती है पुष्पांजलि का वीडियो.
Ma'am, page 2 पे है, madam. Page 2 पे है.
Ma'am, shall I take over?
Yeah, please.
Yeah, so I'll start sharing my screen. Are you able to see?
No, ma'am, not yet.
No, ma'am.
No,
ma'am.
Wait a minute.
No, madam.
Not one second. Now?
Yes, ma'am. Now we can see.
Yes.
Yeah.
Yes,
Ma'am, thank you so much. I'm extremely sorry for this delay.
No problem.
I don't know, sometimes it happens.
Yes.
And I liked what ma'am said. Patient will not care how much you know. They care for how much you care for them. And that is one quality we need to teach our students, which is unlikely nowadays that they get this particular, competency or this attitude. So just to introduce myself, related to community-based learning. Okay. I do have experience with community-based learning. I was in BP Koirala Institute of Health Science, Dharan, Nepal for 6 months. And there they started this community-based learning in a big way. They had invited experts from India to help them initiate this program. I represented dental and made sure dental also is part of this mega program of community-based education. And 2007 is where I'm working as Ramaya group of institutions. So there we started this community orientation program in 2007. The medical college played a pivotal role in conceptualizing this program. And I took an initiative and said, why not dental students? Why only medical students? So from 2007 onwards, both our PGs and undergraduate students are part of community orientation program. It's a wonderful program, really wonderful program. They learn something which they don't get to learn in a hospital-based setting or a classroom setting. If you have to just explain as to what happens in this community orientation program, the medical students, the dental students, the physiotherapy students, the pharmacy, the nursing, and now the allied health science students, all of us come together as one group. It's called Interdisciplinary Community Orientation Program. We help them work as a member of healthcare team, more diverse healthcare team. So the whole program is for 2 weeks, rural setting and urban program. The urban program, we take them to urban slums, visit to NGOs and many other settings, and also give them the prerequisite knowledge required to spend time in a rural setting. Then 1 week, we take them to village. So the entire batch of 450 or 500 students is made into 7 groups. So every time we adopt 7 new village. Now, Kaivara is our field practice area, which has 21 villages. So in a cycle, we take 7 villages once in every 3 years. So 7 groups, and each group gets 1 village. And the group has members from students from medical, dental, physiotherapy, nursing, and pharmacy, and now allied health science. So they stay in the village for entire 1 week. They learn about community. They stay with them, with the community, in the community, from the community. They learn. And what they learn is something different. You should listen to what my students say after they finish this entire program. They come energized. They get to stay with a family. They conduct family studies. They conduct community oral health survey or the general health survey. Then they visit school and they do school health program. Then they have community health education program. And they also have community health camps. And the last day they conduct Shramadhan, that is giving something back to the society from where they have learned. So you should see the way they contribute to the village that they have learned. In diverse way they exhibit. And then when they come back, when they present, they're all so energized. And that energy is there for next 3-4 months. And basically what happens is they would have developed some kind of, favorable attitude. Now, why we started this program is to inculcate attitude that is compassionate and empathetic attitude towards patients. So with this objective, we conceptualize this. And with the students, we teachers are there, the PGs are there, the interns are there from all specialty. So this is my experience with community-based learning. It's wonderful. It's going on really well. And second thing is, I was very happy to be part of the previous discussion. Ma'am said teacher has to be innovator. So every time I do something different. You can see jigsaw in my class. You can see pass the pointer. You can see even that muddiest point. You can see that. And I have also used rubrics for the reports, and I've found to be very, very beneficial. You get consistency in assessment. So all of these things I do. I'm a passionate teacher. That's all. I would like to introduce myself as a passionate teacher. Now, with this introduction, going ahead, what can you expect from this session? Let us understand what is community-based education, community-based learning. Then also understand what are the benefits of having this community-based education from a larger perspective. I'm sure all of you will be part of members of board of studies or academic committees, or some associate deans will be there, or future deans will be there. So you all have to think differently. So from that perspective, I would like to say, what are the benefits of having community-based education? And also probably through your case scenarios or plenary, we can discuss scope of integrating CBE at your institutions or in your departments. So first, let us understand what is community. Community is what we've understood as group of people who follow social structure within a society. Now, since there was confusion and each person from public health perspective is to understand in a different way, a qualitative research was conducted from Kathleen et al. And collected information, conducted in-depth interview from diverse group. And this is what she has arrived at. It is a group of people with diverse characteristics, yes, we understand, who are linked by social ties, share common perspectives, and engage in joint action in geographical locations or settings. So for our understanding, we can say a group of people sharing similar characteristics who reside in a defined geographical location. So this is community for us. Now let us see how we can utilize this community for the benefit of our institution, of our departments, and for our students. Now, what is community-based medical education? It consists of activities that use the communities extensively as a learning environment, where students, teachers, community members, and representatives of other sectors are actively engaged throughout the educational experience. Now, the experience that I shared as to what we are doing at Ramaya Dental College, this is what we spend time. The teachers with community members and representatives from NGOs, from government also will have people coming over and they spend time with our students. So throughout this educational experience, we stay together. So that is community-based medical education. Of course, there are different definitions for community-based education, community-based learning. So there are two things. One, we need to understand the community-based education, community-based learning is limited to a pedagogical tool, or you can call it as instructional tool. Only when we use community-based education, when we use community only to bring about, give students learning experience, then it is community-based education. Then what is community-oriented medical education? So this is from a broader perspective, looking at a curriculum itself. The whole curriculum will be community-oriented medical education. From first year to last year, students spend most of their time in the community. The whole purpose of this curriculum is to have community-oriented doctors who are able and willing to serve their communities. So this is from a curriculum perspective. Now CBE is only as a teaching learning method. So let us look at CBE as a teaching learning method for this particular presentation. Now you might ask, why should I know about CBE and CBL? Now, in my opinion, existence of any institution is to suffice four requirements. One is for academics. We should do our best for our students. Research, yes, we should conduct research that is relevant to society, provide care to our patients, and also demonstrate social responsibility. So when it comes to social responsibility and giving our best to academics, I think community-based education comes into picture. Not only that, it can also be related to research. That is from the institution perspective. Second, from the student perspective, it will enhance social and emotional aspect of student learning. Now, you must have understood that there is cognitive, psychomotor, and affective domain. So if you're looking at affective domain, if you want to manipulate, if you want them to develop empathetic attitude, then community-based learning is one method that will really contribute in shaping students to develop favorable attitudes. We have many examples where the students they don't even care to even tell us, senior patients, that there is an elevator, why don't you take the elevator? Even if the patient's attender is pushing the wheelchair, they don't care to go and help them. We have such kind of students which I have seen in many places. So if you want to bring about the change, and if, as ma'am said, they care about how you care for them, so we need to look at developing this particular competency, develop sense of social responsibility, and also collaborations between educational institutions and communities. So for all this, community-based education is the answer. Now, what are the taxonomy? Classification, we have service, we have research oriented, we have training oriented. Now, service oriented is when you post your students to primary and secondary centers. Research oriented is when you stay in the community, identify what is the gap, health gap, and try to rectify it. That's research oriented. And training is when you purely use community for just training your students to develop, enhance their competencies. Like the example that I shared, what we do is purely training. Now, I was looking at Dental Council of India regulation, like most of our faculty say, why should we do? So I thought to convince them, let me also show them that yes, it is in the DCI. Many a times I say it's not in DCI, so why should we do? It is very much in DCI. When I did a content analysis of Dental Council of India Regulation 2007 for the undergraduate program, including amendments, and tried to find out how many times the word community has been written. So the highlighted ones are all related to community. It indirectly says that you have to enable students to stay in the community and learn about community, understand the determinants in community, and treat patient as a whole. So all those pages, maybe around the 4 to 5 pages in the regulation, does mention about taking students to community. So it is very much in Dental Council of India regulation. So we can follow this method. Okay. And another thing is, most important is now it's all about NAC. Everywhere it is about NAC. Yes.
अभी तक भारी है.
Can we ask some? Is there some disturbance?
60 वाली, ठीक है?
Okay. Okay.
Can you mute Sonali? Sonali, mute, please.
When it comes to accreditation requirements, the criteria 1, the criteria 3, criteria 5, and criteria 7 you have scope for showing community-based education in all this, or anyone, it depends. So if you are not an affiliated college to any university, if you're a private university, then you can have your own curriculum. You can have community orientation program like how we have a 5-credit curriculum. They have to pass this. They have to earn credits by attending community orientation program. So here we get points. And research, innovation, and extension, they very clearly say that you have to conduct research relevant to community. So if you adopted a community, then you have to conduct research. There you get point. Extension activities, adopt a community and do something over there. You get a point over there if you have documents. Student support and progression. What value are you giving the students for them to develop social responsibility? That is the metrics that we have for criteria 5. Yes, there again, you can show community-based education. Institutional values and best practices. The best practices for academics, yes, if you have community-based education, you can show it there as well. So we have seen that the Dental Council of India also recommends, and NAC requirements, you will get additional points if you have this particular teaching learning method or in place of curriculum. Now, having understood about community and community-based education, that is learning with the community, I thought I'll take you through a case, the Suez Canal University. There are quite a few universities which are following community-based education. And in India, I think we have St. John's, Ramaiah Medical College, Sevagram, AIMS, New Delhi, CMC Vellore, and Banaras Hindu University. These are few colleges which are following, which have community orientation program. And when it comes to dental, I'm not sure about the other colleges, but Ramaiah Dental College has a very, very structured community orientation program for dental students. That is in 3rd year. So over here in Suez Canal University, it started in 1978, where the health problem was quite huge. And to address that, they opened a medical college, and instructed Professor Ismat and Numan, both husband and wife, internal medicine specialists, to start a medical college and look at developing graduates who are socially responsible, who work with the community to solve their problems. So they had these institutional objectives. Kindly look at the second objective, to relate medical education to the community health needs of the society. So it was very explicitly mentioned in their objectives. I also request all of you all to go back and look into your institutional objectives, vision and mission statements. I'm sure you'd have mentioned somewhere about social values, social responsibility, because there is no vision and mission nowadays without the word social responsibility. And if you have it, how are you fulfilling it? So you have to show evidence. To fulfill that, what are the program outcomes you have? So to fulfill your program outcome, what are the course outcomes you have? So in that case, you need to show what program you have. So similarly, these people worked hard to fulfill their second objectives and started with training at primary healthcare center to enable students to bond with the community, identify the common health problems over there, and be an integral part of healthcare team, and also develop clinical skill competencies. One more point over here is we need students to develop transferable skills. Now, what are these transferable skills? The skills that are required for them when they go back to function as an independent practitioner. It is required. It doesn't end with only cognitive abilities. There are many other skills. So such kind of programs, other than your classroom setting, will definitely enable them to develop these competencies. With this brief about community and community-based learning and why CBE, what are the benefits, let us break into your breakout rooms. Dr. Sai has already given the case scenarios. Group 1 will have case 1, group 2, I think it's case 2, 3, and group 4 and 5 will share case 4. Since the case scenarios were already distributed, can we just spend around 10 minutes?
Samik?
Is that okay?
Samik, breakout room करसे?
हाँ मैडम थसे
10 मिनिट પછી આપણે ઈ કરશું.
ઓકે મેડમ થઈ ગયું ચાલુ. હા રિક્રિએટ કરજો.
Pushpanjali,
ma'am.
if you want to enter the rooms, you have to just click on the number and you can enter the room just to take a round and encourage them.
Okay, okay.
Yeah, everybody can do, even Sai, Vibha, everybody can do.
There are 3 breakout rooms, right, ma'am?
Five.
Okay.
So you above that the breakout room number, you click that on the side, there'll be join, just join that. When you want to leave, you leave it.
Okay, okay.
So that way you can enter all rooms.
And better patient care, madam. Patient care. Better patient because the patient got the necessary direction and help from the.
Hello, Pooja. Good evening. I'm good. Session is going on and we are really missing Chinmay.
Hello, ma'am, can we start? Ma'am, you have to unmute.
Samik,
Hi, madam.
I बंद कर.
Okay.